My name is Dr. Semei Mutesasira. I am an anesthesiologist. I work in the ICU and theatre. Yes, please. ICU or intensive care unit is a place where we treat the critically ill patients. Those are patients whose organs need to be supported. It can be the lung, it can be the brain, it can be the kidneys, it can be any other organ. So it's a place to treat those that are critically ill, those that need to also be monitored and can't be done on the usual wards. My role in the ICU, one, I will review the patients. In reviewing the patient, it involves examining the patient, taking the history. Most of the times among these critically ill patients, they're not able to speak. So all we do is to get history from the caretaker or the immediate family. The other thing, after getting that history, we shall investigate. If the patient needs mechanical ventilation, we shall connect that patient mechanical ventilation. If the patient heart needs to be supported, we shall do so as well. So my work is basically to treat those patients, but ultimately it is God who heals. Yes, just like any other profession, we treat and the God heals. Yes. Patients need ICU or intensive care units so that we can take care of those organs. It can be the lungs, for example. Some patients can come when they are not able to breathe. So that's when we choose and say, let us support their breathing using what we call commonly the life support machine. Some of them could come when their hearts are too weak and we need to support the heart. Others, they could have other organs on top of the kidneys and we need to support. So it's a place where we support the organ functioning until a state when they are stable enough to be able to continue care on the usual wards that are commonly known, whether it's a medical ward, surgical ward, among others, or a pediatrics ward. The most common myth is that whoever goes into ICU, they die. But that is not the case. Usually, patients come out. By the time a patient dies, it means that they were meant to die. But at least you're able to extend their lives for some time. We have classical examples. For example, currently the Pope has been in the ICU, has been on the life support, but he's off at the moment as we talk. The most common infection that we see in the ICU is a lung infection, where patients are not able to breathe. This is just like how you saw in the COVID period. The most important thing is timely intervention in these patients. Once you get an infection, you have breathing problem, run to your doctor as soon as you can so that you don't end up requiring the mechanical ventilation or the life support. It can be very terrible and the outcome can be good or bad depending on how you come in. But it's one of the commonest that we see in the intensive care units. When people say, when you're in the ICU and we say your patient is brain dead, what we mean is that your brain is not functional at that moment. And we know that the brain is the master organ. It controls the rest of the system. So for us, medically speaking, brain death is equivalent to death. That's what it means. It's equivalent to death. So it's usually a matter of time, the rest of the organs will shut down. So when the patient is brain dead, we usually sit down families and choose to get off life support because once the brain is gone, you're as good as dead.